What do I do about her brain? What do I do with that beautiful brain of hers? Because those women, they need GABA to be active. They need their anti-anxiety partner. I need to think of their brain. I need to think of them. This is going to sound controversial because it is. Testosterone. Testosterone. I'll use testosterone cypionate injectable in these women, anywhere from, 5 milligrams to, in some cases, up to 20 milligrams, even 25 milligrams I've seen. And this is very careful prescribing on my part as a physician because you're not a man, but you need testosterone just as I need estrogen. There's a harmony and balance in this. So you're saying, Brendan, what would testosterone do for me? Testosterone crosses that brain barrier as well, and it binds that receptor in the brain a little differently because it converts to something called androstenediol. And what that does is it has a similar GABA activity in the brain that's different. It doesn't cross that pathway. So I've had very, 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 very good results using that in women. What else is benefiting me with that testosterone? Testosterone also modulates the estrogen receptor, so it's supportive of progesterone's role as an anti-estrogen or a balance to your estrogen. It's just when you give a woman testosterone, you have always must watch for the downstream metabolites that come from that. So if you give a woman testosterone, you have to make sure you're aware of the fact that testosterone will want to convert over to dihydrotestosterone. Dihydrotestosterone needs to be kept in a very tight range for these women to prevent them from having side effects. You want to have them have benefit without cost. If this is the thing that's going to be the glue that holds them together while they're going through therapy or whatever it is we need to do to get them better, or if this is just what it's going to be, we should do it without consequence. As your doctor, it should always be my goal to make sure it gets into your body and stays stable, doesn't create the downstream metabolites. I'm accountable to you with my lab work every 6 months, and I'm being a good doctor for you, always. So in cases with that allopregnanolone reverse responding, when it's purely allopregnanolone, and it has to do that allopregnanolone intolerance that is out there, these are my approaches.